Good evening, Nurse Fernando Torres. I am Celestine Alexis Dolioso, and this is my partner, Mr. Einrad Miguel Cagara. We are interviewing you for the purpose of the assignment in fundamentals of nursing practice. For the first question, for the role of the nurse manager, do you consider that nursing skills or management skills are most relevant? Why?
Yes, good evening, Sir Celestine and Sir Einard. I am Nurse Fernando Torres. Before we get into the interview, let me introduce myself. I've been a nurse, graduate of Bachelor of Science in Nursing from the University of Perpetual Health, Las Piñas campus. So, and my nursing career is more focused on the pre-hospital care, but I believe that I will be helpful and informative with regards to your questions and to the information that you will be needing for your tasking. So let's proceed. On your first question, for the role of nurse manager, do I consider that nursing skills or management skills are most relevant? Why? As a nurse manager, first you must to be a team player. Why team player? Because you cannot lead a team if you don't have a team. Okay? For example, you will be tasked to have other nurses, your subordinates, to do such things, such skills, such provision of, for example, provision of certain care like medication, assessment, follow-up. And to be an effective manager or team leader, you must possess your management skills or managerial skills, but not compromising your nursing skills as well. Because in order for you to master your management skills, you must first master your nursing skills. For example, in the assessment part, you will be the one to guide them what they will assess, how they will assess, what are the things to look for, what are the considerations. But how can you guide them if you don't know those things? So for me, these are both important. The nursing skills and the management skills are very important and relevant as a team player and as a team leader. So with that, you must be a team player, because you cannot manage your team or you cannot lead your team if you are lacking communication, you are lacking assessment, clinical assessment, you are lacking other skills that are necessary for the position that you are currently having. So that's it.
For the second question, as a nurse manager, what do you believe is the most viral feature that nurses, particularly the future generations of nurses, must obtain?
For me as a nurse manager, one of the key components of being an effective team player or team leader is communication. Because if we have a proper communication within the team, you can properly exchange information, you can properly execute the interventions that are needed. For example, a simple miscommunication can lead to a patient's death, or rather adding more injuries to a patient that are supposedly receiving the proper treatment or care that he or she should have. For example, a simple miscommunication in the medication. A simple miscommunication in medication can lead to a person's life that will be the cause. If you have given the wrong medication to the wrong person, that's the end of your career. Okay? Do you get what I'm saying? Because if you don't have proper communication to your patient, proper communication with the other team players, the doctors, the nurses, nurse managers, it's okay to communicate, to confirm such things. For example, what I'm saying earlier, the medication. You confirm with your patient. What is your patient's name? Give them the 10 rights, the everything, to ensure that you are giving the specific medication, the specific dosage, specific dose to that patient who has to receive that certain medication. And you have to confirm as well to the other team players like the doctor that say, hey doc, is this really the medication, the dosage for this particular patient, for this particular client? With that, you are saving yourself from future problems, because giving the wrong medication will cost you everything that you have worked for, your license, your schooling, all of it will be in vain if without proper communication is imposed in your team. As a manager, you should encourage your teammates to have a proper communication. For example, they are having struggle in handling with a certain patient, a combative patient that they are struggling with. They should communicate that with you so that you can reassign, reassess, or if there's a need for transfer of care to other team players, it will be properly endorsed.
For the third question, discuss a time when you work in a fast-paced environment. How do you prioritize tasks while providing the best possible care to your patients?
Okay, that's a very good question. For me, I practice in a pre-hospital care. It is very fast-paced and we need to make decisions quick. We need to make assessments quick and objective and very close to as much as whatever possible treatment you will give. So, being a nurse, you must first assess. Then, later on, you will have your intervention and then evaluation and then documentation reporting. With all of these things that you need to do as a nurse, you must to be very, very knowledgeable in comes to your knowledge skills. Okay? Because when you practice gaining knowledge, when you practice your nursing skills during the course of your study, during the course of your training, when you are in that situation that you are needed to do such things, to decide what to do, you are already being cautious with your decision because you have already practiced that during your training. I am also an educator, I am an instructor. What I'm telling my students is, magkamali na kayo habang nandito pa kayo sa training, or let's correct your mistake while you are in our training, because out there in the field there will be no one beside you, no instructors, no teachers, there will be only you, and you will decide what to do in those kinds of situations. That's why whenever I teach my students that they have to be very critical in studying their skills, in mastering their training, because you have no time to decide or to think that much, because for example in pre-hospital care it is critical. Time is very critical. Every minute counts, every second counts. That's how important it is. Now, how can you gain those kind of um, prioritization, those decision making skills? For example, in a pre-hospital care, if there is a certain victim, do you have to load and go the patient or stay and play? When I say load and go, let's pack the patient, put it in an ambulance, and deliver it to the nearest hospital. When I say stay and play, we can treat the patient on the site of incident. Okay, we can assess the patient on the site of incident. So there are many factors involved like time, environmental conditions, and everything. That's why you need to develop your training, your skills, your knowledge during the training time, the schooling time. In that case, you will lessen your time prioritizing, you will lessen your time thinking hard on what to do with the patient.
Good evening. I have 3 additional questions. First, how do you manage your responsibilities during this pandemic?
Okay. We all have different kind of responsibilities in our personal life, work life, and other aspects of our life. Now, speaking on the professional career, on the professional aspect, I have managed my responsibilities during this pandemic by being proactive in healthcare. What I'm trying to say is, as a nurse, we learn that prevention is better than cure. And we are proactive with that. Prevention means to say, before the disease come or the disability come, we promote health and we are proactive in disease prevention. In my career, I've been promoting the social health protocols, the minimum health protocols during this time of pandemic, as I am also practicing it as well. Because what we say, what we share, what we preach, we must practice it. And by being proactive in the minimum healthcare standards, in the social distancing, use of face mask, sanitary practice, hygienic practice, by simply doing those things, you are minimizing the risk of contamination, you are minimizing the risk of contagiousness of the disease, and you are also improving your health, your immunity by proactively taking good care of yourself. And with those kinds of responsibilities, I also share those things with my family, my friends, because as a nurse, as a part of the healthcare system, we are supposed to be proactive in sharing the things that we know that could help other people as part of health promotion and disease prevention.
Second, what are your own personal strengths and weaknesses in this area of expertise, and how these 2 factors affect your career?
As a nurse, I have my strength and weakness in some of the areas in my personal career. How I deal with those things is a matter of, with my strength, I improve it, And with my weaknesses, I cope up with. What I'm trying to say is, when you focus on your strength, you have your energy, your passion, you have those things in you. You just have to improve it. For example, last year, you are on this level. These are your strengths. On the next year, you should be higher than that to improve your strength. The same goes with your weaknesses. These are your weaknesses. Don't blindly what you call that? Don't just blindly look at your weaknesses, but you must improve your weaknesses in order for you to improve. That's why as of the moment, I am also currently studying my master's because I want to improve my weakness, which is teaching or talking to other people in a crowd. Because what I've realized in my career is that whenever I was in a patient care, I am only taking on a one-on-one basis. If you're in a hospital or if you're in a pre-hospital setup, you will be dealing with patients 1-6 average of that every day. At some areas, you will be dealing with 132, 150. And what I've learned is that I am limited by those things. That's why I am studying right now to improve those things. I am sharing what I know. I am sharing what others need to learn. And by that, I am improving myself and helping other people to know the things that could help them as well. So for me, education is part of our nursing practice because as a nurse, we educate people. In your path, in your career, you will realize that, especially in your nursing education, in your health education, that you will be educating patients, families, community, and by simply educating them, you are equipping them with some knowledge, some skills, some practices that will be very helpful with their everyday life.
And last, what advice would you give to aspiring nurse who wants to be a nurse manager?
Basically, being a nurse manager, being a leader, being a team leader is somewhat more on being a open communicator, because you cannot be a good leader if you're not a good communicator. For example, you want to express to your teammates, to your team members, your objective for your shift, for the week, for the month, but you are an ineffective communicator. And by being an ineffective communicator means that whatever your objective is, whatever you are planning with, it will not come to life. You will not hit your target because you don't have that open communication within you. On the other hand, I will be advising you, future nurse managers, future nurse educators, that you must have an open communication with your teammates, with your patients, with your other team players, because by being an open communicator, you will achieve your objectives and you will come up with a very fruitful and positive target. Okay, so with that, I would like to share to those future managers that it's okay to understand being a manager, being a leader. It's okay to learn such things, but if you're not an open communicator, there will be barriers behind between you and your client, your patient, between you and your co-nurses, between you and other team players. It will be an ineffective situation for all of you. That's why I encourage that you will be an open communicator for you, so that you could achieve your goal and you could achieve the things necessary for your nursing care.
Thank you for your answers to our questions. Mr. Delioso, do you have something to say?
Nurse Fernando, thank you for the time and for those wonderful answers to our questions. We are looking forward to see you in the future as your fellow nurses. Again, thank you.
Thank you, Mr. Fernando.
Thank you.